So I was born with pectus excavatum. I suffered with it for my entire life. At the age of 33 is when I actually discovered the term and the name pectus excavatum. And every doctor I would go and see always just would tell me it's just cosmetic, but I suffered with physical pain in my chest, my back. I was getting depressed. I gained a bunch of weight. I was about 280 pounds at that point. I felt like I was gonna die. So I went to my primary doctor, wanted to check my blood pressure, my eyes, ears, nose, throat. Then he's like, take your shirt off. I want to listen to your heart and your lungs, your breathing. And at that point, I just went to take my shirt off, but I just want to warn you, like something's wrong with me. I don't want you to be startled. So I took it off. He's like, oh, my daughter has that. That's just cosmetic. You know what that's called? Like, no, I don't know what it's called. And I was just shocked. Like, I felt like I was the only one in the world with it. I've never heard that term or seen anyone else with it ever. So he told me it was called pectus excavatum. And at that point, I just wanted to leave and go look up that term. And then that led me to the name Dr. Jaruzelski. And then I got in touch with Kelly Myers, which is Dr. Jaruzelski's pectus coordinator. I was getting really excited, and I'm like, this is really going to happen. So my wife and I flew to Phoenix, had my consultation with Dr. Jaruzelski and her team, and then 2 months after that, I had my surgery. For surgery day, I just kind of had this sense of calm, like the fear and the depression and everything just kind of stopped. Like, I was ready for this. Like, whatever the outcome was, I was ready. Like, I needed this surgery. So I have 3 titanium bars in my chest. I'm 1 year post-op, so they've been in me for 1 year, and they're going to be in me for about 2 more years. During that time, everything's just healing, and they're like braces. It's pushing up my sternum, holding it into place. I can breathe for the first time ever. Like, the sensation it's unreal. But as far as my symptoms go, they're completely gone. I'm not in any pain from the surgery at all. My breathing is completely changed. Like, I can take a full breath in. I've never been able to really experience that. All the problems with my heart beating out of its chest, completely gone. I feel 100% better. I've been running and swimming and cycling. I'm actually training for a full Ironman in October. Dr. Jaruzelski, Kelly Myers, her pectus coordinator, Mary Ann, and their whole team are amazing. Like, I don't even have words to describe how awesome they are.